Hey, I'm Mel.
Hey, I'm Mol.
Welcome to the Podyssey.
With the GlioBabes.
2 girls.
2 brain tumours.
What could possibly go wrong?
Well, let's find out.
Hello, and welcome back to the Podyssey. In today's episode, we are joined by Lorcan Butler, who is the Optical Engagement Manager for the Brain Tumour Charity. Lorcan, thank you so much for being here with us today. Please, can you introduce yourself, tell us a bit about what you do, and how you've ended up on the podcast today?
Yeah, thanks for having me, guys. So my name is Lorcan. I'm an optician. I work with the Brain Tumour Charity full-time. My role is Optical Engagement Manager. Well, that means I go around and engage with people involved in the optical space, opticians, people working in hospitals, healthcare practitioners, GPs, just talking about the signs and symptoms associated with a brain tumour that can be picked up with an eye examination.
So, as an optical professional supporting the charity, can you explain the connection between the eyes and the brain and why changes in the vision can be sometimes one of the earliest signs that something neurological might be happening?
Yeah, great question. And sometimes people don't get it, to be honest with you, Mel. But about a third of people with a brain tumour can actually have visual problems. And that can be somewhere along their brain tumour journey. So it can prompt a visit to a GP or to a pharmacist or an optician. And these visual problems can be blurry vision, change in eye movement, and they can all be quite concerning. And when we go to the optician, then the optician can have a good look inside the back of the eye and refer them on to hospital or back to the GP if required. So a lot of these eye problems can occur due to the tumour itself. It can also happen secondary to the treatment of the tumour, or sometimes it can actually happen due to medication or other medical conditions that are caused by the brain tumour. So epilepsy is quite a common secondary condition associated with brain tumours, and sometimes medication use for epilepsy can have an impact on the eyes too as well. But yeah, not many people know that brain tumours and eyes do tend to be quite linked.
So my brain tumour was actually picked up through my eyes. And when I went to the hospital, they kind of talk about how the eye is like the window to neurological health. And I think it's so important to be able to kind of understand that and kind of how your eyes are kind of like the window to your brain, I guess, in some respect. And you can pick up a lot of things through an eye test, not just brain tumours.
Yeah, it's the only part in the body where the blood vessels are open and transparent. So we can see a lot of vascular conditions. So high blood pressure, high cholesterol, diabetes, and we can also see neurological conditions too as well. So the back of the eye is the front of the brain. So when we look inside the back of the eye, we can actually see a tissue which is made up of the same tissue that's found in the brain. So it's actually quite breakthrough at the moment as we're talking about screening for other neurological conditions such as Alzheimer's and Parkinson's, multiple sclerosis. We can see now these biomarkers of these conditions in the eyes, and sometimes preclinical 5, 6, 7 years before they're actually detected. So we have some fantastic technology and some fantastic equipment to screen for these medical conditions. So early detection, early referral, early treatment is, the number one thing we're looking for. If we can catch it early, if we can kind of detect it early and treat it early, it tends to be a fantastic opportunity for everybody to get a better treatment.
You mentioned some of the kind of like red flags for symptoms when it comes to eye health, but for families listening, it could be difficult to know when headaches or squints or blurred vision, doubled vision are common and when they actually become concerning. Are there any patterns people can look out for, or combinations of symptoms, changes over time that kind of would make someone think this needs urgently looked at? And also, importantly, will all brain tumours present with eye symptoms?
So going back to your first question, kind of signs and symptoms, red flags, the main things to look out for would be things which are becoming worse, progressing in nature, increasing in duration, increasing in frequency, increasing in severity, such as a headache, for example. So it's not normal to have a headache which gets worse and worse. And usually with a brain tumour headache, it can be sometimes more worse in the evening time or worse in the morning time, waking up with a severe headache, sometimes waking up with nausea, vomiting. So these kind of red flag symptoms should be brought to the attention of the GP or the optician. The majority of people tend to go to the GP, but it can be quite concerning, especially getting an appointment to the GP with the current burden on the NHS crisis. It can be 4, 6, 8 weeks. So there are other healthcare practitioners you can go to, such as your community pharmacy or community optician. And sometimes people aren't aware that, the optician, the eye examination is free of charge for children too as well. So sometimes costs can be prohibitive and they aren't aware that they can go free of charge. Going back to the question you mentioned about eyes, again, anything anything concerning your eyes or vision, so double vision, blurry vision, change in a movement. The one that you said is squint, is which is a turn in the eye. So the eye turns inwards towards the nose or turns outwards towards the ear. That is not normal. And that would be a red flag. And that can be sometimes brought on by just a problem with the muscles in the eye. But approximately a third of squints can be associated with a brain tumour. So anything that's not normal, anything that's changing and getting worse, progressive in nature, should be seen to, and earlier rather than later.
So when you're concerned about someone's eye health and you think it could be something neurological, what happens next? What's the next movement after that?
Yeah, an awful lot of people just think optometrists are there just to prescribe glasses and contact lenses, do eye examinations, but we're specially trained to pick up general health conditions, as I mentioned before, high blood pressure, high cholesterol, diabetes, and also the neurological conditions. So sometimes we can pick them up quite early, sometimes we can pick them up at kind of a moderate or advanced stage. And if we do notice these, then we can refer the patient onwards quite quickly. So we tend to have a national guideline set by a professional body. And this kind of guideline tells us what to do when we see these medical conditions or neurological conditions. If they're quite mild, quite early, then we can refer them back to the GP, who will then send them on to hospital for further treatment. If we find the condition is more serious in nature, we can refer them themselves to the hospital, to the eye department, and that can either be a routine referral, what we refer to as a routine, which is a couple of days, couple of weeks, or we can do an urgent referral. An urgent referral is, I'm going to refer you to the eye department in the local hospital now, today. I would phone the hospital myself and triage and make sure they're seen by a consultant, and then let the consultant take the patient and treat them accordingly. So not many people are aware of that. So we do a lot of emergency referrals. People come into us with severe headaches, severe eye problems. We look inside the back of the eye and we can see optical signs, visual signs that it could be something neurological. We aren't able to diagnose, but we can know that's not normal. And therefore we can see that isn't a normal finding, that needs to be investigated further. And I want you to go and see a specialist now, today, urgently, to get this seen. So a lot of the eye conditions we see can be sight-threatening, but they can also be life-threatening too as well. So again, it's going back to the medical training we receive to be able to pick up these red flags. And we always have a duty of care towards our patients. So we'll always play the safety card at all times. And it's down to us then to know when urgent or how urgent that referral could be. If we think it's non-urgent, just a routine referral back to the GP with a letter of information. If we think it's quite important, we can see signs of stroke, somebody on the cusp of a stroke, we would send that person down to hospital straight away. If we saw signs of neurological change at the back of the eye associated with a brain tumour or other conditions, then we refer to hospital that day on an emergency basis.
Sorry, I'm just gonna go in again because this is so interesting to me, especially because this is how my diagnosis was picked up as well. So when you were saying there about, if eye problems are caught and you think it's something neurological, there can be that same day urgent referral. I was exactly the same. So I had my eyes tested because my vision was really blurry, and Mol said something really good in an episode previously, and she said those vision problems, it's kind of like, when you go to take a photo and before you tap the lens to kind of get the focus, that kind of like blurriness is how people, like, we can describe how we feel with our eyesight and losing that, and the double vision and things that can come with that. But when I was diagnosed with severe papilledema, and that's then what sent me to the hospital to have the CT scan.
Yeah, so you'll tend to find blurry vision can occur at all different ages, and it can be lots of reasons. It can be down to lack of blinking, our eyes being dry, our tears which cover the front surface of the eye, which give us good clear vision. That can lead to blurry vision. So as an optometrist, you'd hear that term blurry vision all day, every day, and it's down to our training or down to expertise to find out, is that normal, is it not normal? You mentioned about double vision too as well, Mel, and double vision is not normal at any time, and double vision for any healthcare practitioner is a red flag. That's an emergency referral. It can be associated with other general health conditions such as a transient ischemic attack or a stroke. It can also be a sign of a brain tumour too as well. And then what you mentioned is papilledema, and papilledema is a condition where the pressure inside the brain gets higher than normal. It tends to be seen at the back of the eye. As I said, we look at the back of the eye, it's the front part of the brain. We as optometrists know it's a papilledema, that's the term, and then we will need to refer that for neurological assessment. We don't know what's causing it. Papilledema can be caused by lots of conditions. It can be caused by hydrocephalus, which is water on the brain, or encephalitis, other medical conditions such as a bleed, a bump, a lump, an abscess, a hemorrhage, or it can also be a brain tumour. So at this stage, as an optometrist, we wouldn't know what the causative factor is, but we know it's not normal. It needs to be seen urgently, and we refer you, and that would be the route that you've gone down to as well. So 10 out of 10 for your optician for picking that up and being able to refer you onwards.
Lorcan, if you don't mind, I'd like to strip it back a little bit. And for people to understand what the difference is between an optician, an optometrist, an ophthalmologist, I think we come across many different people. And obviously I say obviously, maybe there isn't a journey in how that happens. So are you able to kind of explain to us what the difference is between those people?
Yeah, an optometrist is the official term for an optician. So there are two different types of opticians. There's a dispensing optician and an optometrist. So if you were to come in to me, I would usually introduce myself and say, hi, my name's Lorcan, I'm the optometrist, or I'm the optician. So you'll tend to find they'll be the people who test your eyes, who look inside the back of your eyes, who can detect these ocular conditions, general health conditions. An ophthalmologist is a GP who's gone on to do further 7 years of training to become an eye surgeon. So an ophthalmologist is a GP who does specialist training to become a consultant, and that consultant is specialising in the eyes. So they would tend to be a GP surgeon who has gone on to become a consultant surgeon. So that's the difference between an optometrist who works in the high street and an ophthalmologist who would tend to be in a hospital or private setting.
There's
It
so
does tend to
many
be confusing. It's okay.
There's so many different roads to go down, isn't there? I always thought that it was like an ophthalmologist is an optician and vice versa, but an extra 7 years of training is insane.
Yeah, and there's also one we haven't spoke about, which is an orthoptist, and an orthoptist works in the hospital eye department, and they tend to come under the allied health practitioner. And they tend to be, again, a specialised topic. They go to a degree course, they spend 4 years in college, and they deal with turns in the eyes, a squint in the eye. And a squint in the eye isn't normal, and it can be caused by a brain tumour, both in children and adults. And an orthoptist is somebody specially trained to be able to find out what the cause is causing that squint or turn in the eye. It could be down to the muscles, it could be down to something further back in the eye, such as a brain tumour. So if you had a double vision, you'd be seen by an optometrist in the hospital who would look inside the back of your eye. You may be seen by an orthoptist who looks at how your muscles work if you get double vision. And you'll also be seen by an ophthalmologist, the eye surgeon, the eye consultant.
So let's say someone, goes through that first step. And I know some of this we've already gone over, but I think to make it really clear for some of our listeners, if someone goes to that first step, let's say we hear Specsavers all the time. All the time we hear, I went to Specsavers and they referred me on, and mine wasn't picked up through an eye test, but then later on, even after my diagnosis, they noticed that raised pressure, optic nerve, and then it was straight to the hospital. What can someone expect if they are referred from an optician to a hospital or a specialist? What would that look like?
First of all, the optometrist should be able to inform the patient why they're referring them. And that would be a case of we've detected something irregular, we've detected an anomaly at the back of your eye which needs further assessment. We have specialist tools which we can look inside the back of the eye and we can screen and triage, and we know it's normal and we know it's not normal, and we know then we have guidelines on what to do when we detect an anomaly and we need to refer somebody on. We can detect ocular conditions. We can't diagnose, or we can't say what's causing them. So when we look inside the eye, we can see behind the eye. So the eye is a closed structure. So we look inside the front of the eye. We're looking in the eye itself. We can't actually see behind the eye. So that's where people need to go to hospital for further neurological assessment. And that can be an MRI scan. It can be a CT scan, X-rays. They have, again, specialist equipment in the hospital which can do much more than we can do in primary care optometry, which is high street Specsavers optician. We would explain to the patient the importance of attending, we'd explain the importance of the referral, and we'd also explain the timeline. We'd also explain we'd like this to be done within 2 weeks, within 4 weeks. I'd like you to go back to your GP and ask your GP to refer this. We'd also explain it might be a more urgent referral. I'd say, I'm going to do this now. I'd like you to be able to go to the hospital now. And that can be a difficult conversation to have with anybody because they're working, they've got family, they've got kids to pick up, but we need to be able to, stress the importance. This could be a sight-threatening condition. This could be a life-threatening condition. We need you to accept the responsibility. We need you to go now. So those would be kind of, the timeline. We would explain to the patient what we're finding. We're finding something that's not normal. It's irregular. We don't know what it is. It needs to be screened. We don't have the proper equipment for that. You need to go to hospital, see a neurologist or an ophthalmologist who has specialist training, and they'd be able to find what's causing this irregularity.
That's the scary thing, isn't it? When you get told, you need to go to hospital now. For me, that was my reaction. Like you said, Lorcan, my appointment with my ophthalmologist, which was done privately through my GP, because I was having vision problems, and at the time they thought I had migraines. So I went to see the ophthalmologist, and I was sat in the chair, and I was getting examined for at least 45 minutes. And I was sat there, and at the time, I felt okay. I didn't have a headache or anything like that. And I was just sat there, and I was thinking, oh, this is going to be a waste of time, this. And, it kind of got to that point because I'd been ill for so long that I did start to think it was something psychological. And when someone then looked at my eyes, and then that kind of set everything off in motion, it kind of completely changed my direction in terms of like a diagnosis or things getting picked up on quicker. And I remember, this isn't like, I'm not going to disclose any information on who it was or anything like that, but when he looked at my eyes, he was like, you need to go to hospital now. There's something behind your eyes. Like, you need a scan and a further assessment, and then they'll go from there. And I remember saying to him, I was like, do I need to go now? I've got an MRI booked in for Friday, and this was on the Monday, so a few days prior. And he said, no, you need to go now. It's been left too long. But the fact that he was able to pick that up through my eyes is just insane. But, you've said it yourself, like the eyes are the window to the brain, I guess. But in terms of your role now, Lorcan, and, how you're working with the Brain Tumour Charity as an optician, tell us about a day in the life for you. What does a day in the working life for you look like in terms of that awareness, in terms of that understanding for eyes and how it links to brain health?
Yeah, so my typical day is usually kind of based around education. So I'm usually kind of, going to conferences where I'm giving talks to optometrists, ophthalmologists. If I'm not going to a talk, I might be preparing for a talk. And these talks are how to detect a brain tumour in an eye examination. What signs and symptoms would a patient present with? Would it be a child? Would it be an adult? What we're actually looking for when we look inside the back of the eye, and what we should be referring, and how quickly we should be referring those. So an awful lot of people in practice are very, very busy, and sometimes they, don't come across these eye conditions quite a lot. They are quite a niche presentation. So I was working in practice for 20 years in the high street, testing eyes, and did I come across a brain tumour once? No. But I knew if I did, what I would do and what the signs and symptoms would be. So that's my role, raising awareness through education. I do online presentations, I go to conferences, and I also write content in educational magazines. We also have a fantastic health engagement team who engage with other healthcare practitioners such as GPs, oncologists, and other allied health professionals, and I would help and guide them too as well. So it's raising awareness through education.
So you've spent this podcast educating us greatly. You've educated lots of listeners, helped give context, which is very important, especially when anxiety and emotions are high, to kind of have an idea when things feel out of control, maybe what is going to happen next, and kind of really, really made sense of information that maybe we thought we kind of knew, but sometimes it's just really messy and it doesn't make sense. And that's why we really wanted to get you on the podcast today. So could you explain to us why you think your role is so important? Because of course, these professionals, as you said, was it the optometrists or the ophthalmologists that had an extra 7 years of training? If people have had that training, what is the importance? Why is you being there and presenting this to them so important when they've had that training?
Yeah, so as I said, a detection of a brain tumour is not a normal occurrence, okay? So 20 years in practice, I never came across one. You may be lucky or unlucky to get one in one career. You might get, like buses, you could get 2 in 1 week. So the early detection and early signs and symptoms, the awareness of these, knowing what it could be, and the importance of onward referral. So if somebody comes in and to an optician, we do a lot of eye examinations every day. We know it's normal. And when somebody comes in and they have something a little bit different, it tends to prick up our ears. It tends to kind of, give us an awareness and hang on a second, that doesn't normal. That could be a red flag. Let's look into this further. And then that gets us on kind of, the path to investigate what is causing these problems. That we listen to the patient too as well. So they said, I've been to the GP 3, 4, 5 times. And that's a very common, conversation we have. People lose trust, they lose rapport with the GP because brain tumours tend to have so many different non-specific symptoms, which are very difficult to kind of, to pin a diagnosis on. So that people can kind of, go through a revolving door process with the GP. And then they just kind of, lose interest and lose trust in the GP. And then they just present to accidents and emergency. And that is too late. And that tends to kind of not be favourable. So educating patients, educating the community about the importance of going and getting a check with your GP, with your pharmacist and with your optician if there's anything wrong. And one of the things you said, Mel, too, as well, is, you were ill for quite a while and people just tend to put up and they accept it and they think, oh, it's just down to me not being right. It's just not down to me sleeping. It's just down to a lot of stress. And they tend to put off that it could be other things. So nobody knows they're going to have a heart attack. Nobody knows they're going to have a stroke. But going to a GP, going to an optician, we can see inside the back of the eyes and we can detect these signs that there could be something about to happen or will happening. And that child who has maybe blurry vision, you let that parent or grandparent know, get that checked. It's not normal. Okay, so it's just kind of a case of raising awareness for parents, grandparents, carers, and just community people like yourself. Just the raising awareness that, if you do notice something that's not normal, that isn't a normal characteristic for you, if it's continuing, if it's not getting any better, if it's getting worse, it's getting more uncomfortable, leading to, not a normal daily occurrence for you, it's time to get that checked out.
So you mentioned there, Lorcan, about grandparents and parents looking out for signs and symptoms in children and young people. We know brain tumours are the biggest cancer killer of the under 40 population. But when it comes to those young people and children, how is it best to keep an eye on that? No pun intended. Children sometimes don't know how to communicate those things. So how do you think is the best way to keep an eye on that change in behaviour or vision for a child compared to a young adult?
Yeah, and again, it's just taking ownership. I mean, sometimes now, if you go to pick up your child at school, it's, both parents are working. It'll be the grandparent who'll be kind of, picking up the child, and they be maybe the first one or a carer to hear about the headaches, not sleeping. A change in pattern. Maybe they're becoming a bit more introverted or a bit more extroverted. They're becoming a bit more sleepy. Changes in vision, blurry vision, not being able to see the whiteboard. So those should be kind of red flags. And sometimes if the grandparent or carer just pass that information on to the parent, then the parent may not understand the importance or the severity, or they have a busy lifestyle and they don't get it done. So maybe as a grandparent or a parent, taking ownership of the concern. And some children, aren't able to vocalize these issues, especially, young children, they aren't able to kind of, vocalize these. But we always tend to kind of, be able to tell from a concerned parent who comes in, we'll always give them priority over their child's health. So, we want them to get them checked straight away. But sometimes people aren't aware that the eye examination is free of charge. Sometimes they think there will be a cost, and cost can be a prohibitive factor preventing children getting their eyes tested.
We're going to take a slight topic turn. Something when we were preparing for this podcast, you mentioned that made us both kind of like go, oh gosh, this is really, really, really important. And I think something that lacks conversation, lacks answers, is a complete messy point, but also a really emotional topic is driving, the DVLA, communication, all of that becomes a big mess. So we wanted to spend a section on that because there are so many things that we could cover and go over. As two young people, and Mel will go on, I'm sure, to tell you more about her experience. Driving for everyone, that is our independence. We rely on it. As young people, it's exciting to be able to achieve getting your driving license and have that independence. I didn't have my license taken off me, but it was decided that I just wasn't going to drive. And my parents, I was very privileged that they were going to be able to take me places, and had some great professionals that also supported in that too. But we know that it still remains an incredibly emotional topic for all people, not just young people living with brain tumours. So would you be able to outline for us the rules around informing the DVLA after that diagnosis and what the process looks like in reality?
Yeah, of course. It is a very delicate, it's a very sensitive, very, very emotive topic, and a lot of people aren't aware of what the requirements are. So happy to share. So it's a legal requirement to surrender your license once you've been diagnosed with a brain tumour, and the onus is upon you. As the driving license holder, you need to contact the DVLA and surrender your driving license. If you don't, you can face a fine up to £1,000. If you don't surrender your license and you are involved in a road traffic accident, or maybe a healthcare practitioner is concerned that you shouldn't be driving and they contact the DVLA, then your license will be revoked. Your license will be taken off you. And then what tends to happen is you'll go through your brain tumour treatment, and whenever that finishes and your GP, your consultant, your multidisciplinary team give you the all clear to go ahead, then you can reapply for your driving license. And when you reapply to the driving license, the DVLA will look at your medical records, will look at your health records, and depending on the type, the size, the treatment of your brain tumour, if there's any other medical conditions such as epilepsy, then they'll take that into consideration, and they may want to issue with a new driving license, which has a time restriction, maybe 1 year, 2 years, 3 years, and they'll review it accordingly. Unfortunately, it doesn't happen that way. That's the reality. The reality is, unfortunately, people aren't aware of it. GPs, healthcare practitioners are very reluctant to take that independence away, and it tends to be a double whammy. You know, you go to hospital and here's a consultant telling a young girl, I'm sorry, you've got a brain tumour, oh, and by the way, you can't drive. So an awful lot of healthcare practitioners don't mention it because they're probably a little bit kind of concerned that's going to affect you, you know, emotionally, mentally, so they assume somebody else will. When people are told they have a brain tumour, they aren't aware they have to be able to give up their licence. Some of them will, some of them won't. Some of them are reluctant to give up their driving licence. Some of them will hang on to it as a form of independence, and they tend to be disobeying the requirements. They tend to be breaking the law. There's an awful lot of reasons why people are afraid to give up their license. It may be the only photo ID they have. So if they go to a bank to make a lodgement or to make a withdrawal, if they're flying on a plane, airlines now require photo ID. They may not have a passport. Passports are very expensive for people. So people may use their photo ID and they just tend to kind of, don't want to surrender the license. And it tends to be a huge, inspirational, factor for people to get back on the road again. So when they're going through the treatment, they're kind of, I can't wait to get back driving. I'm really looking forward to getting back driving. I'm kind of a burden on my family. I'm kind of asking my wife, my sons, my daughters to drive me here or there, hospital appointments. They're so keen to get their license back. So it does tend to be a very emotive topic.
You said it yourself there, Lorcan, it becomes a double whammy. I never even kind of thought about losing my driving license. So I had surgery, so I kind of had to surrender it from that perspective. But the strange thing is, the day I was diagnosed, I was out driving like that morning, but I didn't have any qualms not to. I wasn't told anything by anyone, but that's the scary thing. My vision was heavily affected. I didn't need glasses before I was diagnosed or had surgery or anything like that, but I think because my eyes were affected prior, it's kind of something I live with now. I'm not complaining about that or anything, but it's that reapplying for the license. I really struggled to get mine back. I had surgery and I didn't have any other treatment or things like that. But to me, it felt like the DVLA were making it harder for me to get my license back than what I thought it was. So, I was told from my consultant originally, before I had the surgery, he was like, oh, 6 months, blah, blah, blah. So then I got to 6 months and, I reapplied for my license and sent everything off. And then they sent me a letter saying that my license had been revoked, even though I knew I had personally surrendered it. And it comes down to like those issues of reapplying. And, sometimes you're speaking to someone at the end of the phone at the DVLA and it feels like they don't really know where to take your case from there, if that makes sense. So, I can see why people would struggle to surrender their license in the first place. But in terms of reapplying for that, is there any, like tests that need to be retaken? Do you need to retake your driving test? Reassurance from a professional would be great for those that are currently going through that, I guess.
Yeah, so just to kind of highlight that I tend to be a DVLA liaison officer for the Brain Tumour Charity. So I work with the DVLA quite closely. So I'm part of what we call a medical forums charity. So the DVLA will engage with lots of other charities across the UK, such as diabetes, narcolepsy, blood pressure, stroke, any medical condition which can impact one's ability to drive. So we meet. The DVLA are very, very transparent. They're very open. They're very easy to engage with. They're very kind of, keen for us as stakeholders to be able to engage with them and can pass on our concerns. When they reassess somebody's license, when somebody reapplies, they have a medical panel, and that medical panel will look at your medical records. They will look at your GP's records, your consultant. And depending on the type of brain tumour, where it's located, the grade, etc., they'll stratify your risk. Will that person be a risk to themselves? Will that person be a risk to other road users? And as you said, Mel, you felt okay. The majority of people feel they're okay until they're told they have a brain tumour. And an awful lot of people say, I'm driving. I've driven for 40 years. I've never had 3 points on my license. I'm an expert driver. But they may not be a good driver. Their vision may be failing, secondary to the brain tumour. Maybe treatment of the brain tumour itself has left a problem with their vision. But people are a little bit kind of blind to that. And they kind of say, I'm fine. I'm a great driver. I've been driving for 50 years. I've had no problems. But unfortunately, they may be a threat to themselves, or they may be a threat to other road users. They may be epileptic, secondary to the brain tumour, and that can lead to a seizure. So the DVLA medical panel take each case on a case-by-case scenario and stratify the risk and say, would that person, if they have an epileptic fit at the wheel, what would happen? If they were driving 60 miles down a motorway, and they have all the statistics with regard to age, gender, brain tumour type, and with regard to accidents, road traffic accidents, and what tends to happen. So they do tend to have the kind of, the statistical analysis to say the probability of that person having an accident is quite high, or the probability of that person having an accident is quite low. And that's where they tend to make that decision. So it is difficult, but it is based on protecting you and protecting other road users.
To anyone that's listening, that maybe this could have been the first time that they've heard this and they've been newly diagnosed. We find people listening to the podcast that have somehow they search, and clearly we've been doing something right when it comes to SEO, because we come up pretty high, and we've had lots of messages from people that have just been diagnosed or they've just been put in for their surgery and they're waiting for it. And so for those people listening, because there's probably more than we realised and have reached out to us, what do they need to do now? So if no one's mentioned this to them before and they've been diagnosed, what sort of that first or next steps do they need to take? Like, where do they go? Is there a DVLA website? Do they need to go to a specific thing? Do they have to ask their consultant? Where do they sit right now?
Yeah, very good question. And it does tend to be, as I mentioned earlier, sometimes healthcare practitioners, GPs, we tend to use medical terms until we know it is a brain tumour. So if somebody comes in, we might say, we have a concern. We can see something on the back of your eye. We can see something on the MRI scan. We see a shadow. We see a lesion. We need to get this checked out. And it can be, a days, it can be weeks until actually somebody says it could be a brain tumour. We need to go do an investigation. We need to do further investigations, an MRI scan or a CAT scan or biopsy. But at some stage, you will have somebody who will tend to say it is a brain tumour. and that is the official diagnosis. So when a consultant or somebody of the multidisciplinary team say, we are going to diagnose you with a brain tumour, and we're going to treat you for this brain tumour, that is when the official diagnosis occurs. And once you receive that official diagnosis, then you have to contact the DVLA and surrender your licence. The DVLA have a very, very easy to use website, and all you have to be able to do is to fill in an application form, surrender your licence, or even just a small piece of paper saying, my name is, this is my date of birth, this is my home address, this is my GP's name, I've been diagnosed with a brain tumour, I'm surrendering my licence, and post the licence to them. You can hang on to the paper part of your driving licence, you don't need to send that part, but just the plastic photo ID card, that's the official one part of the driving licence. The second part is the paper part that you can keep, and you need to surrender or volunteer, give up your licence, and then the DVLA will contact you and say, yes, we've received your driving licence. It's very, very important you do that, because if you don't surrender your licence, and then unfortunately you are reported to the DVLA for driving, or maybe you're involved in a road traffic accident, your driving licence will be null and void. It'll be revoked, and that is going to make it so much harder for you when you come to reapply. So the DVLA would like people who are legal, who obey the laws, who are compliant with the requirements. When somebody refuses to give up their licence selfishly because they don't want to, or they feel, I need my photo ID, then the DVLA would look at that person maybe as non-compliant and maybe non-obligatory, not being compliant to rules and regulations. So they would look at you slightly different. So that would make the application process when you're reapplying for your driving licence much harder, because they feel that maybe this person can't be trusted. This person is not going to be able to give them the information. So they will exclude you from all the communication, and they will concentrate solely on your GP, on your consultant, on your multidisciplinary team. And that can take a process of sending medical reports and then waiting for the consultant to fill them in and then sending them back, and that can increase the duration and make it much more longer. So the textbook answer is, when you're diagnosed, it's your onus, it's your responsibility to surrender, to give up your licence. If you don't, and the DVLA find out, it's going to make it much harder for you when you come to reapply for your licence, because they'll say, we can't trust that person, they're non-compliant, they didn't volunteer the licence when they should have, we need to be able to deal with that person appropriately, and we can't trust them, we need to go to their healthcare practitioner, their GPs, consultants, multidisciplinary team.
Maybe that was why mine was revoked, because I was diagnosed on the 19th. I had surgery on the 23rd, so I hadn't even left the hospital. And it wasn't until the new year, when I'd came home then, and after I'd had the surgery, that I then surrendered my licence and started getting all my affairs in order to, move forward with it. So whether they presumed that I was driving around or not, I don't know. But maybe that's why I've got it back now, all good eventually.
Yeah, so in theory, you should be giving up your driving licence when you get diagnosed. So maybe there was a delay in the process. Maybe you weren't told, Mel, you didn't know what to do. But the DVLA may have looked at your case and said the date of diagnosis and the date of surrendering the licence was 2 months, 3 months, etc. And we don't favour that.
I was in hospital, guys. Give me the benefit of the doubt.
The amount of people, I suppose this is where everything connects, isn't it? And it's a full circle. Like the whole idea of the season that we're so grateful that you're on for, Lorcan, is professionals, and how you guys connect is so much, because obviously for a lot of professionals, they're seeing a few patients in a day, and we've had people on that say, like, you have one or two that stick in your mind, but otherwise you get into this process, and obviously you love your job, you love your role, you want to make a difference, but it is a job at the end of the day, and you keep going over. But for us, we're like, right, this is our one body, this is our one brain, this is our hopefully one or a few brain tumours, and all these people are looking at that one thing. So from this side, it's interesting how we know that A&E diagnosis is ridiculously high. We know that the Brain Tumour Charity and other charities, third sectors, are looking at it very closely, because it's not okay. So there's something there. It's weird, but it also makes sense how close these things connect, because until we get the faster diagnosis, the signs and symptoms, until we get that done, then people can't be there. Otherwise, they're like Mel, where they did not leave the hospital between diagnosis, surgery, and that rehabilitation beginning, coming home, and in that time, a huge thing's happened. I keep my driving license on me, but I don't think anytime I've been in hospital, I've not been well enough to actually think about the fact that I need to post this to the DVLA, or we can't get up and walk to post it to the DVLA. So it's a knock-on effect, isn't it? Because if we don't get that right and people don't get diagnosed outside of that A&E setting where it's like, you are not going home, then that can happen.
And also as well, you may not have been told. So an awful people aren't aware of the fact, and you're looking for guidance. You're looking for that nurse or CNS or oncologist or a multidisciplinary team to kind of say, have you informed the DVLA? And it can be a very difficult conversation to have, and especially when you receive a diagnosis of a brain tumor, everything's going through your mind, everything's going through your thoughts, and the last thing we want to be able to do is kind of say, you shouldn't be driving. That can be enough to kind of cause a very difficult conversation to have. So an awful lot of people can sometimes avoid that. They assume somebody else will tell them. But yeah, it is very difficult. And unfortunately, the DVLA get the blame when it's not their fault. So I was on a radio station recently, a local caller phoned in and was complaining about the DVLA being taken so long to get his driving license back. He was going through emotional and mental health well-being because of it. It was affecting his quality of life, his loss of independence, and he was talking about how the DVLA have stolen his independence. And luckily, I was able to contact the gentleman, have a conversation with him, get his permission to contact the DVLA and have a look to see where the process was. And they were still waiting for a medical report from his GP and consultant. And that's what tends to happen, is the DVLA will send out medical records to the GP, to the specialist, to find out, is this person being treated? What is the treatment? When will the treatment finish? When will they be discharged, etc.? And if the GP and the consultant doesn't fill that in and doesn't send it back to the DVLA, that's not the DVLA's fault. So there does tend to be two sides to the story. You need to be able to be, as the brain tumour patient, is to take onus and responsibility and say to your GP, once your treatment has been finished, can I now return to driving? Can you give me the all clear? What do I do now? How do I go about reapplying for my license? And that, again, never happens. So people to kind of say, yeah, you're fine, you can go back to normal now. So the DVLA work very, very well with all the medical charities, third sector, they're very transparent, very open. And just unfortunately, people tend to kind of blame the DVLA when it could be the GP is holding them back. It could be because the oncologist is holding them back because they haven't sent the MRI scan, they haven't sent the CAT scan. So again, the patient, the brain tumour sufferer, needs to take ownership and take accountability and say, what do I do now? Where do I go now? How do I contact the DVLA? How do I go about contacting my form? And that's where we get a lot of people coming to us, reaching out to us through our website and saying, I'm having difficulty getting my license back with the DVLA. Can you please help me? And we'll give them guidance on what to do and the best method of trying to reapply for that license.
So speaking of that early diagnosis, Lorcan, and the signs and symptoms, can you tell us about the Head Smart campaign, and what is it, why does it matter, and how do you think it can help families in recognising those earlier signs and symptoms?
Yeah, the Head Smart campaign was a fantastic campaign we launched back in 2011, 2012. In conjunction with lots of other professional bodies, we did the Children's National Brain Tumour Centre in Nottingham. We had the Royal College of Paediatrics. We had NICE, the National Institute of Healthcare and Excellence. And we produced a pocket-sized concertina card talking about the signs and symptoms that children, babies, toddlers, teenagers would have. And this was designed for both healthcare practitioners, but also non-healthcare practitioners. So it went out to hospitals, went out to schools, went out to libraries, went out to any area where there was, children being seen or being looked after. And it talked about the signs and symptoms, such as maybe headaches, maybe nausea and vomiting, maybe a difficulty in their coordination, falling over, an increase in their head circumference, which is quite common when we tend to have a brain tumour in toddlers. Mood changes, vision changes. And it was very, very simple. We talked about one sign or symptom going to the GP, and if we had two of those signs or symptoms, asking the GP for an urgent referral. And the whole idea, Mel, was to get that diagnostic time quicker. So what tended to happen at the time was we look at the time when the first symptoms occur and we go to a healthcare practitioner looking for guidance until when the brain tumour is diagnosed. And at that time, it was 14 weeks. which is crazy. And that was 3 times the average in America. So the whole idea of this Head Smart campaign was to decrease that delay. We call it a diagnostic interval, that timely diagnostic interval of getting it down from 14 weeks to 11 weeks. So by raising the awareness of early signs and symptoms, people who are involved in children and looking at children say, well, he doesn't seem himself. He's getting a bit sleepy. He's getting a bit kind of cranky. There's changes. He's falling over. That doesn't sound right. And by looking at the signs and symptoms card, they're able to kind of think, okay, I think I need to get that child referred to the GP, talking to the patient, talking to the parent, talking to the grandparent and saying, this isn't normal. So it still is a very, very popular campaign and people still remember it because the impact it had. And it was all about early detection, seeing these signs and symptoms, and then signposting the person that needs to get looked at.
This is a difficult one. You may not be able to answer it, but I'm very intrigued that obviously you mentioned that this was like 15 years ago, this campaign. And we know that we've also had Better Safe Than Tumour since then. Many of us were involved in getting the cards out, putting them in our GPs, but time and time again, we are still having people on the podcast, people as young ambassadors for the charities, involvement champions, telling their story where they went in with these symptoms and it was pushed off. They asked for referrals and it was pushed off. And then it became an A&E diagnosis or unfortunately a way too late diagnosis. And that person has lost their life very quickly. For me personally, and my symptoms were put down to my gender, which I see an understanding in, and my hormones did play a massive part, which I know is mentioned very slightly on the Head Smart booklets. But even though there were multiple of those things there, my parents were still massively fighting, and that was quite some time ago now. But we're having people on that. If we use Hayley and Lily's story, for example, she came on the podcast and explained how her granddaughter Lily, it was going back and forth all the time. And yeah, we're seeing it all the time. Richard Rawcliffe and his son Joe, when it was put down to his mental health, and then he lost his life very quickly from that moment of surgery, from in a matter of days. 15 years on, we're still struggling. There is still a massive struggle, and I'm not really sure what to ask you off the back of that, but I think it is unfortunately it is a fact, isn't it? And these resources are excellent, and we are all working, you guys, the charity, the people like us impacted, working so hard, and the families that are grieving, that are bereaved, that want to make a difference for other people, even though it won't help them because it is unfortunately too late. We're still in this big mess 15 years on. Like, what do we do now? Like, what comes next?
Yeah, it's trying to share the information, share the education, let people know what those early signs and symptoms are, getting guys like you to advocate your story and tell about how you felt fine. There was no issues, but just a routine eye examination picked up this papilledema from Mel. And just, taking ownership too as well. Yourself things aren't right. You go to the GP said it could be down to your hormones, it could be down to stress, it could be down to other factors, and you tend to accept that. And then you go back a second time knowing your symptoms haven't resolved and going back more concerned, and then them asking you again saying, no, it's okay, and again taking ownership and saying, well, I don't feel I'm okay, I need to be seen, I'd like to be referred. And then there's lots of other people in a GP practice now as well, apart from a GP. The GP practice get funding by the local health boards to employ other healthcare practitioners. So you might have an independent prescribing pharmacist. You could have a physiotherapist, called a first contact practitioner. You could have a paramedic. You could have a physician associate. So there's lots of people to see in a GP practice. So if you're going back and maybe the second time, you might kind of thinking, I don't trust that. I've lost the rapport with that GP. They aren't taking me seriously. You can be seen by somebody else, asked to be seen by somebody else. And then same with the Head Smart cards and the Better Safe Than Tumour, we always indicate that if you have one sign or one symptom, it's enough to go to the GP. But if you have two signs or symptoms, then asking the GP for a referral. And sometimes people aren't aware of that you can ask the GP to be referred and say, I am concerned. I know it's not normal. I'd like to be referred for further assessment. And that's a very strong sentence you can say to the GP, and the GP isn't going to ignore you. But people are sometimes afraid and thinking the GP will know more than me. And, they think it's that. But we all tend to have that gut instinct. We all tend to know something isn't right. We all know ourselves. We know that things are not normal. And when you get pushed off once or twice, you can accept that. But then we need to take ownership and accountability and go back and say, I'm not happy. I want to be seen. I want to be referred. Can you organise that for me, please? Or how can we organise that together? See, if your headaches are persisting, they aren't getting any better, go to the GP, go to the pharmacist, go to the optician. Any vision changes, anything odd, just don't ignore it. So, we're there to help. We're there to refer onwards. We're there to get it early diagnosed, early treatment, more favourable prognosis for everybody, rather than kind of, sitting at home, worrying, concerned, getting yourself into a mental state of despair, thinking, oh, this isn't going away. So there is that kind of, we all need to kick up the backside and taking onus and responsibility and say, get it done. Go to the GP, the third time, ask for a referral. So, there is that kind of onus and responsibility that we need to take at all of our times. And sometimes it can be difficult to do that. But when you're feeling down and feeling crap and, there's something not right, as you said, Mel, we all know our body is much more better than anybody else. So if there's anything going on, get it checked out.
I think that you've just hit the nail on the head there, Lorcan. It's all about advocating for yourself, isn't it? And at the end of the day, I say it all the time, nobody knows your body better than you, like not even a GP. So if there's something isn't right, you need to keep pushing for that, and I'm so glad that you've picked up on that. So thank you very much. This episode has been so insightful for me, and I know it will be insightful for everyone else as well. So thank you so much for coming on to the podcast and, covering about those early diagnoses, what the role of an optician, an ophthalmologist, and all those different people within that space can do in terms of picking up on a brain tumour and how it does get diagnosed, and those referral pathways and the DVLA and spotting signs and symptoms in children, and how we can push that further quicker, and communication between schools and parents and grandparents. It's all been incredibly insightful, and again, no pun intended. So thank you so much for your time and coming on to the podcast today.
You're very welcome, guys. Pleasure to be here. And if anybody wants to reach out to me, have any questions or any concerns, please share my details. I'm quite happy to speak to anybody.
That's brilliant. Thank you, Lorcan. We will make sure we put the details in the show notes of how people can go about doing that. Speaking of the show notes, if anyone's been impacted by today's episode, we know that whilst we can have a laugh and have a really insightful chat, again, pardon the pun, I didn't realize how many puns there would be. This is backed by a really, really rubbish reason. So if you need support, all the helplines for the charities are in the show notes as always, and you can reach out to us. You can find the GlioBabes on Instagram at the GlioBabes and TikTok at the.GlioBabes, and Mel and I have pages on all social medias. As well as that, a reminder that we are in season 6, which is our first ever professionals. We've had a GP, we've had an oncologist, and now you've got Lorcan as well. This is an incredible season it's shaping up to be. So please continue to tune in. You can find the podcast on Spotify, YouTube, Amazon Music and Apple Podcasts. I believe that's all of them. And we have 5 seasons before. We have incredible guests that we've mentioned. We mentioned Hayley Conroy. We mentioned Richard Rawcliffe. You can find their episodes, as well as ones of just Mel and I having a chat as well. But the guests and the professionals, we're good, but they're really, really good. So please go and tune in. And yes, thank you so much. What an episode. This has been great. Thank you.